Hi. In this coronavirus pandemic, more than 70% of the patients admitted to intensive care unit in England, Wales, and Ireland were obese. There's also a report from New York that those who were admitted into the critical care unit under the age of 50 years and ventilated were again obese. I've just come back from my clinic, and you know what? All my patients turned up. Well, this was a non-face-to-face, that is, I had video consultations. And everybody turned up. Normally, 30% absentees are there in my clinic, and worldwide, 50% of the patients do not attend their obesity clinics. That's for several reasons. But today, everybody turned up. And during the clinic, I usually ask them, what's your motivation? Why do you want to lose weight? And the usual answer is, I want to get my diabetes sorted out, or I want to be fitter, or I want to wear a bikini for the summer holiday, or play with my grandchildren, or it could be even I want to travel in an aircraft and not ask for an extended seat belt. So there are lots of reasons why someone wants to lose weight. But today, sadly, everybody was asking me, Doctor, what should I do so that I don't get this infection? I don't get this dreaded COVID-19. But sadly, people with obesity are more prone to not do well when they get this infection. There's a large study from the US which showed that obesity was the main determining factor of whether to admit them or not to admit them. Another study showed that even if you're young, but if you're obese, there's twice as likely to be admitted in the hospital for COVID-19 infection. So that clearly shows that obesity is a factor in poor outcomes. And that's been seen in studies coming from China, Italy, United Kingdom, USA. It's very sad. I'm going to tell you three main reasons, and these are all based on research papers being published. I've never seen so many research papers published in such a short time, and some are not peer-reviewed. But I'm going to quote you some. So let's split into three main bits. The first bit is on ventilation. So what's ventilation? Ventilation is when our lungs take in air from the atmosphere, and there's a gas exchange, and so oxygen goes into the blood, and then carbon dioxide gets out. So basically you inhale, and so imagine this is not coronavirus, by the way. This is an alveoli. That's the small balloon-like structures in the end of the lung. So they go into this alveoli, and then there's oxygen coming into the blood vessels and carbon dioxide going out. So that's ventilation. The problem in obese people is that they have hypoventilation. So they don't do well. They don't breathe well. So let me just explain this. Obviously, because of social distancing, I couldn't get any of my staff or patients to come. So I've just got my daughter's teddy bear to explain. Let me show this to you. So imagine this is Mr. Smith, and Mr. Smith is obese. Is one of the typical patients. As you can see that Mr. Smith is sat down. So in people who are obese, they have problems with ventilation. So that is breathing in and out. But if there's lots of fat around the abdomen and the chest, what happens? The lung volume is reduced. So they can't breathe well. It's shallow. The next thing is, there's a diaphragm between the chest and the abdomen. In between, there's a diaphragm, which is a strong muscle. And to breathe, your diaphragm has to move in and out, in and out. Whereas in people who are obese, it's splinted. That's what it moves. It moves slightly rather than going up and down. So that there are very important reasons why an obese person finds it difficult to breathe. And the next important reason is something called sarcopenia. Sarcopenia is a condition when there is less of the muscle mass and muscle strength. So let me put it in a very easier way. So suppose you have a fracture. You put on a pot, a plaster of Paris pot for a few weeks, and once the pot is taken out, how do you see your limb? It's shriveled. You lost your muscle. And that's what happens in people with morbid obesity, severe obesity. So one of the reasons, as you rightly understand, is because of inactivity. There's less muscle mass. But we endocrinologists actually understand that it's not just the inactivity. There's a lot of inflammation, a lot of inflammatory markers which weakens the muscle. So they do not have enough strength. So the muscles around the chest are weak. So they're more prone for chest infections. I've been discussing with my intensivist friends, those who are anesthetists working in intensive care unit, and they tell me that ventilating an obese person is very difficult. And especially if they've got a lot of other medical conditions, it becomes even more complicated. So ventilation is difficult. In COVID-19 infection, there's a significant problem in ventilation. That's the end result of the whole infection, but ventilation is the key. And ventilating an obese person becomes even more difficult. You know, when you have to ventilate a person, they have to be sedated. So they are knocked down with sedatives and then they put on this breathing machine. So the whole idea is to extubate, that's to take out the tubes, and they breathe on their own when the help from the ventilator is taken away. So intensivist is very careful. They try to assess whether this person is going to do well. So the sad question, the next question would be, who gets a ventilator? How do you assess whether someone is going to be ventilated? So the intensivist usually looks at who's going to do well. That's how they assess. As doctors, care is provided the same to everybody who comes into the hospital. Everyone who comes into the critical care unit is provided the same level of care. But at some point they need to assess who gets a ventilator and for how long. For that, they usually assess whether they would benefit from the ventilator. That's the key question. But if you've got lots of medical conditions, if your exercise tolerance is poor, if you've got diabetes, very poorly controlled diabetes, cardiac problems, stroke, so the chance of not doing well is very high. So someone who is morbidly obese, with a lot of medical conditions, with poor exercise tolerance, that is, they're not able to walk even 5 yards, they get short of breath, their outcome is going to be poor. But thankfully, I understand in the Western world where the mortality is very high due to COVID-19, the number of ventilators are sufficient for now at least, so there is no rationing of ventilators. The next bit which I forgot to tell you about in obese patients is more obese patients are susceptible to something called obstructive sleep apnea. Obstructive sleep apnea is a condition when they do not breathe for a few seconds while fast asleep. And they go on to develop type 2 diabetes, high blood pressure, which again is a risk factor for poor prognosis in COVID-19 infection. And there's another condition called obesity hypoventilation. So as you can see, ventilation is significantly affected in COVID-19. Ventilation is significantly affected in obese people, and an obese person has COVID-19, prognosis is not good. I'm afraid. It's not good at all. Okay, I'm still sticking on to this ventilation bit. My intensivist friends, they tell me that, yes, it's difficult to ventilate people who are morbidly obese. But then there's also difficulty in ventilating the whole of the lung. So let me make this very clear. So we got this right lung and then the left lung. And then as I mentioned, that's the bronchi, the main bronchi, then there's right and left. And they go into the small balloon-like structures, which is called alveoli, where the gas exchange takes place. But most of the alveoli is in the back. So a lot of alveoli is in the back. So let me explain this. Let's get this teddy bear back again. So if Mr. Smith is lying on the bed, all the alveoli is on the back, so they're getting pressed. So the gas exchange is poor. So these days, or normally, they do keep people prone. So this is supine, so they put them on the front so that all these alveoli can, it's more fuller and the gas exchange is better. But the problem is, imagine Mr. Smith, who is morbidly obese. It's not easier to turn Mr. Smith around every time to get them supine and prone. So it's a difficult job. It's not easy, but it's mandatory, and that's what they're doing. That's what I understand. Most of the ventilation these days on COVID-19 patients are done in a prone position.